Do you know 36% of the school kids miss school because of dental pain? Hi, I'm Dr. Garima, periodontist by profession. Before moving forward to the full course on how to keep your kids' dental hygiene at pace from infant till at least 6 years of age, let's first understand that why kids' teeth are so important that we need to maintain them. So let's start with that. Primary teeth, deciduous teeth, or I should say milk teeth, are very important and crucial for early development of our kids. They not only help in social and emotional development, also a lot of times helps in increasing their self-esteem. They helps in chewing food properly. They helps in bringing a permanent tooth into their position. There are so many advantages of milk teeth. So let's understand that first. So number one and most important is they guide our permanent teeth to come into the position. Primary teeth save the space for the permanent tooth to erupt into their proper position. If primary tooth is not there, the permanent tooth don't get the position, the proper position where they should erupt, and they can erupt anywhere from lingually towards the tongue side or buccally towards the cheek side. So for the proper positioning of permanent tooth, deciduous tooth is very important. Second, they help in speech development of the child. How they help in speech? So whenever we speak, our teeth, our cheeks, our lips, they together come into the position and helps in pronouncing a lot of words. And if kids' front teeth are not there, firstly, the child's self-esteem will be down, and secondly, the speech will not be formed. For example, in early childhood caries or because of bottle feed kids, sometimes the kids they lost the front 4 teeth. And that is the age around 2.5, 3 years of age when the child is trying to speak and they are learning to pronounce a lot of new words. And when these teeth are not there, the child will not be able to have a good pronunciation and won't be able to speak a lot of words clearly. That ways, in future also a lot of pronunciations will not be proper for the child. So that is why having the interior teeth proper and intact is very important for a speech development of our child. So maintaining that teeth and having a good oral hygiene also helps in having a good speech development for our kids. Third is poor health and nutrition. As we all know that teeth are very important for chewing the food and eating the food properly and getting the nutrients absorbed. And if your child is having dental pain or the tooth is decayed and not able to eat and chew food properly, first the child will miss food. They will become picky eaters. They won't want to have food. Why? Because of the dental pain. And secondly, once the chewing ability is gone, the child will now not able to chew, just swallow the food and the nutrient won't be absorbed properly. So for proper nutrition and health of our child, deciduous teeth, milk teeth are very important. Child confidence and self-esteem is at toss. If your child is having front decayed teeth, your child will shy away from talking to some people, you're shy away from smiling, from getting photographs clicked, for performing on the stage. They always will feel shy because their front teeth are not beautiful, they are very decayed. Their self-esteem becomes at toss, which actually we don't want, and that not only affect their self-esteem but also the speech of the child. The child will not be able to pronounce some words, and then again they will feel low in self-esteem and don't want to perform on stage. So it's very important to have healthy teeth for kids' self-esteem also. Lastly, healthy permanent teeth. As we all know that permanent teeth erupt very close to the root of the deciduous teeth. So, for example, this is the deciduous tooth root and this is the permanent tooth. And deciduous tooth is very thin in enamel and they are more prone to dental caries and pus and discharge and sinuses and infection. So when this infection goes to the permanent tooth and touch their developing sac, and if the infection goes in the developing tooth, it actually affects the developing tooth from erupting into their proper position. Sometimes they don't erupt, sometimes they don't, they come in a very bad state, they are already decayed, so a lot of problems comes. Let's take an example, like this is our deciduous tooth root and this is our permanent tooth. And we all know that deciduous tooth enamel is very thin and they are more prone to infection and they are more prone to dental decays. So when the infection from the root area touch the permanent tooth and permanent tooth is in an erupting stage, they are about to come and erupt into their mouth, and at that time if the infection touches their sac, the sac in which the permanent tooth is there and it is about to erupt, and at that time if the infection touches the sac, the tooth sometimes don't erupt, they become discolored and a lot of problems come in tooth eruption. So it is very important to have a proper oral hygiene so that deciduous tooth don't get dental decay and they don't affect the permanent tooth in their eruption. So now we have understood in detail that why our deciduous tooth, milk tooth are so important for our kids. Helps in social, emotional development of our child, they helps in erupting permanent tooth, helps in speech formation. There are so many advantages of maintaining the deciduous tooth. If deciduous tooth are not there, your child won't be able to chew the food properly, and definitely it will affect their nutrition and health. So now in my next video, I will be telling you in detail about infant oral health care, how to take care of our infant's oral health when the teeth are still not there inside the mouth. Thank you.